Start.
Have you got set?
Yeah.
Okay. So what I was telling about the new viral molecules. Now new viral molecules are sent from the surfactant cells to the alveoli. Now, if some foreign bodies enter our body will it keep quiet? No. It will also send new inflammatory mediators. It releases inflammatory mediators. I'll draw the picture. New viral surfactant cell. This is surfactant cell. Surfactant cell. Okay, this is the surfactant cell. The surfactant cell. Now, new viral molecules. Okay, I'm drawing new viral molecule right here. Viral molecules. Our body will keep quiet. No, I told in lungs, alveolar macrophages are there, right? Alveolar macrophages. This is going to release inflammatory mediators like IL-1. This by this more production of virus molecules is going to release inflammatory mediators, and which will stimulate the macrophages to release cytokines. What are the cytokines? Interleukin 1, interleukin 6, and tumor necrosis factor 6. These are the cytokines released by the macrophages. Then I told you there is one capillary. This is our capillary, blood capillary. Blood capillary. So what happens? These cytokines, right? These cytokines, it will be produced in tons of amounts because tons of virus molecules are being produced inside the alveoli. So these mediator or the cytokines, interleukin 1, interleukin 6, tumor necrosis factor alpha, they come to the bloodstream. They come to the bloodstream. What happens then? The bloodstream, you know that smooth bloodstream means this, the blood vessels are made up of smooth muscles, right? Blood vessels are made up of smooth muscles. These smooth muscles, they started to dilate or relax. So endothelial constriction will happen. While relaxation, what happens? Endothelial constriction and space, gap develop between endothelial cells, gap. So what happened? Blood will leak out. Blood will leak out. And it will move to the interstitial space. This is the, one second. This is the interstitial space. This is the interstitial space. So blood starts to move out. Blood starts to move out. Okay, this blood which is starting to move out will enter into the alveoli. From the interstitial space, blood transfer, plasma starts to leak out, and it in turn moves to the alveolar sac. Now, what happens? This inflammatory mediators, which is released by the macrophages, goes to the capillary, and it relaxes the smooth muscles. Endothelial constriction happens. Gaps develop between endothelial cells. Blood plasma starts to leak out from the blood vessels and moves to the blood sac or the alveolar, lung sac or the alveolar sac. So now interstitial edema occurs because fluid starts to accumulate in the interstitial space. And alveolar edema occurs because fluid starts to accumulate in the alveolar sac. This in turn causes the surfactant cell, right? The surfactant producing cell, this to be drowned out. This in turn causes this to be drowned out. So once the surfactant is not being produced, surfactant cells become inactive. What happens? The surface tension now increases. Already blood plasma is being accumulated in the blood vessel in the alveolar sac. So now it starts to increase the tension. Starts to increase the tension. Once the tension starts, this alveolar sac will not be able to withstand the pressure. So once if it does not withstand the pressure, then what we can see, one second. this collapsing. Okay, this alveolar stats we will convert to something like this. Alveolar collapse will happen. This, then now you should see, now we can see the signs and symptoms, and we can ourselves predict what it will be the diagnosis if we understand the pathophysiology well, and we can predict what will be the symptoms if we understand the pathophysiology. So what happens? Alveolar edema occurs, right? Edema occurs means a gaseous exchange will happen. No, right? Hello.
Yeah.
Yeah,
Okay.
Sharon.
Gaseous. Okay. Gaseous exchange won't occur anymore because fluid is getting accumulated. When fluid gets accumulated, oxygen is coming. It won't be able to pass through the fluid accumulated in the interstitial space, fluid accumulated in the alveolar sac, fluid accumulated in the interstitial space to the blood capillary. It won't be able. So what happened? There will be hypoxemia, means low level. Mia means exemia. Mia in EMI means in blood. So hypo means low oxygen, less. Oxy means oxygen. Hypo means less. Oxy means oxygen. Mia means blood. So low level of oxygen in the blood. So what happens when low level of oxygen in the blood? Our body will think, I want oxygen. So what happens? We will try to work so hard to get enough oxygen. We will breathe so hard. So shortness of breath occurs. And workload increases for our lungs. Workload increases for lungs. Then respiratory rhythm increases. Since we are not getting respiratory rate, respiratory rate increases. Respiratory rate increases means we are not getting breath. So we will like this, some increased number of respirations, increased number of intake of breath, increased number of intake of oxygens will happen. So we can come to know, so we will see, we have to see for the short respiratory rate, shortness of breath, and some other things are also related. I will continue a little later that. Then now I told you the surfactant, this collapse happened because the alveolar sac was not able to withstand the pressure. There is a law like Lambert's law which explains it well. It is like pressure, collapsing pressure is equal to 2 times the surface tension by the radius. So since the surface tension increases, collapsing pressure increases, it collapsed. Okay, that's in law. Okay, now what happened? Now again, okay. Now we have already learned. Now these were the effects produced by the inflammatory mediators going from the lungs to the blood vessel. These were the effect going of the inflammatory mediators going from the blood, going from the lungs to the blood vessel. Now there are some other this inflammatory mediator has some other actions. These inflammatory mediators, while going to the systemic circulation, relaxes the blood vessel, fluid became accumulated. Now enough gaseous exchange won't happen, so shortness of breath develop and work of breathing increases. Another factor is, while leakage of plasma, along with that, neutrophils also will come to the alveoli. Neutrophils will be pulled into the alveoli. And I know that neutrophils are our immune cell, type of immune cell, like and how they react is they release proteases and reactive oxygen species. Anything with a reactive oxygen species, what happens? Destruction will happen. If any substance can cause oxidation, means that destruction of that substance happens. So what happens? The neutrophils also go with the same procedure. It releases the proteases and it produces the reactive oxygen species. While producing these reactive oxygen species, what happens? This reactive oxygen species, it kills the virus, but then it kills our normal cells also. This will accelerate the collapse of the alveoli. It will destroy the normal cells also. So it will accelerate the collapse of the alveoli. Now what happens? So this surfactant cell is destroyed, gaseous exchange won't happen, collapse of alveoli happened, and neutrophils came inside. So inside the alveoli, what and all things are there now? Pneumocyte type 1 cell debris. Okay, pneumocyte type 1 cell debris, pneumocyte type 2 cell debris, neutrophils, we'll say neutrophils, then fluid, viral molecules, macrophages. Okay, now all these things together will form a consolidation. All these things together form a consolidation. And this consolidation, now if I breathe, I have to pass through this consolidation, then the interstitial fluid, then the blood vessel. So it increases the hypoxemia. Then the hypoxemia develops into a severe case. Two things that inflammatory mediators are responsible for after coming to the bloodstream. But inflammatory mediators are produced in so much amount, so it can not only go to the blood, it can go to the CNS. CNS via the blood only, but it goes to the CNS. And in the CNS, now I'll write the symptoms here, okay? Shortness of breath, working load increases, work for breath increases. Okay, respiratory rate increases. Okay, so these are increases. Now what happens? Now consolidation is there. Why I'm writing? This will be helpful for diagnosis as well. That's why I'm writing. Okay, consolidation. Consolidation. Then now this will go to the CNS. All right. Okay, this is my CNS. Okay. Share. This is my CNS, okay? And now this inflammatory mediators, that is IL-1 secreted by the macrophages, IL-1, IL-6 and macrophages will go to the CNS and stimulate the hypothalamus, stimulate the to release specific prostaglandins like E2. To release specific here, it will be released PGE2. What does this PGE2 do? PGE2 reset our body temperature, causing fever. So another symptom. So another symptom, fever. And then low PO2 stimulates. Now we have all, and then hypoxemia. I told you shortness of breath developed because of hypoxemia. That is low PO2. Low PO2 means partial pressure of oxygen. Compared to other gases, partial pressure of oxygen reduces in the bloodstream. Okay. So what happens? Now low PO2, hypoxemia, shortness of breath, work of breath, respiratory rate, consolidation. Now this low PO2, what it happens? Then fever. Low PO2, what will happen? Low PO2 will go and stimulate the chemoreceptors present in the sympathetic nervous system. It will now, the sympathetic nervous system will come to action. It will produce a reflex reaction. Reflex reaction means what? When we touch a hot pan, suddenly one brain will process to take our hand away. It won't think much. Within seconds, we won't even know that we are removing. That is called the reflex reaction. Same way, when this hypoxemia develops, when low partial pressure of oxygen is there, our body will produce a reflex reaction via the sympathetic nervous system by stimulating the chemoreceptors present in the sympathetic nervous system. For what happens? This will tell. Now hypoxemia develops. Now blood volume decreases, right? Leakage of blood is there. When smooth muscles are decreased, leakage of blood will be there. So blood volume decreases. That also I should mention, okay? Blood volume decreases. So when this all causes this low blood volume and then shortness of breath, enough oxygen is not there, so it will trigger the chemoreceptors present in the sympathetic nervous system, and it will ask our heart to pump more blood, because blood is not there in the extravascular, blood is not reaching to the extravascular, I mean to the body and to the peripheral regions of the body. So because blood volume is reduced, so it will tell the sympathetic nervous system will tell to the heart to pump more blood. Pump more blood means blood is not reaching to the heart, and how the heart will pump more blood? So simply it won't be able to pump. So what the only alternating way is to increase the heart rate to satisfy the needs of the body. The only way is to increase the heart rate. So heart rate will be increased, and respiratory rhythm I already mentioned, right? Yeah. Heart rate will be increased, and respiratory rate also says this sympathetic nervous system will increase the respiratory rate as well as the heart rate. So this is another mechanism. Then this inflammation became so severe and spread to systemic circulation and developed systemic inflammatory acute syndrome. Yes. Systemic inflammatory acute syndrome, and this leads to septic shock, because most of our organs are now facing difficulty to pump the blood, and oxygen saturation is low. What does that mean? Carbon dioxide level in the blood increases. So all this causes leads path to septic shock. Then the inflammatory mediators. And then because of this, because I told, right, inflammatory mediators reduces the blood, relaxes the smooth muscles, and the blood leaks out and decreases the blood volume. So this will in turn affect one another organ. Which organ? So heart and kidneys. So what happens here? When the blood volume leaks out, peripheral vascular resistance. What does that mean? Peripheral vascular resistance means the resistance or the pressure exerted by the blood to its wall. Okay, that is the peripheral vascular resistance. So what happens? The peripheral vascular resistance decrease, and the patient started to develop hypotension, which is very, very severe, which is a like extreme situation for septic shock as well. Okay, the blood volume decreases and the peripheral vascular resistance decreases, and the patient develop hypotension. This is hypotension. Okay, and then now the patient is hypotensive, heart is unable to pump blood, that's why increase the heart rate. This all in turn will affect, when we learned in pharmacokinetics, right, highly perfused organs. This all in turn will affect the highly perfused organ. What are the highly perfused organs? Like brain, kidney, liver, all these are highly perfused organs. So what happens? When enough blood is not reaching to the kidney, enough blood is not, lungs nahi hai, liver. When enough blood is not reaching to these organs, the work efficacy of the kidney and the liver decreases. The kidney will no longer be able to excrete out creatinine or BUN or anything like that. Okay, creatinine, BUN. And the liver, if you see the liver also cannot work properly. So the enzyme stored in the liver starts to leak out, like ALT, AST, bilirubin. Then acute phase reactant like CRP, fibrinogen. Keep this in mind, okay, fibrinogen. These are all useful for our diagnostic test. ALT, AST, fibrinogen, CRP, IL-6. IL-6 is released by the macrophages also, but in liver also as acute phase reactant, IL-6 is released. So then the patient get infected, and the patient develop all the symptoms from all the symptoms are developed between 4 to 14 days. That is known as the incubation period. Okay, that's why we tell don't go out during this period. Other people also can get infected. This is our incubation period. This means all the symptoms will come one by one. But it is said that it can spread till 24 days from an infected patient, the corona disease can spread to another patient for 24 days as well. Now coming to the diagnosis. Wait. Okay. Oh yeah, clinical presentation. Now coming to the clinical presentation, we know that fever. How come? Fever because the inflammatory mediators will go to the CNS and stimulate the hypothalamus to secrete prostaglandins. The prostaglandins will reset our temperature. So we started to develop fever. How come cough? It told consolidation, right? Neutrophils will be pulled into the alveoli, fluid accumulation will be there, debris of pneumocyte type 1, type 2 will be there. All this will cause consolidation. So something is irritating in our lungs, so it has to go out. So a reflex mechanism is cough. So we start to cough. Dyspnea means shortness of breath. Enough oxygen is not there, so dyspnea starts to develop. Myalgia, muscle pain will develop. Like all this can stimulate the pain causing mediator. So in the muscles especially, so myalgia. Fatigue means we'll be so tired, so we'll feel drowsiness and fatigue. Less common symptoms, like in severe cases and all, we'll stay anorexia, sputum production. Yes, we'll start to cough, right? So in that mucus will come out. So sputum production and sore throat. Like this, that's the problem with this corona is we cannot. It's very difficult to identify between influenza by the symptoms. With the help of symptoms, very difficult, because for influenza A and B also, and SARS, other disease also, same kind of symptoms are there, but then GI symptoms are more in corona. Okay, now sputum production, sore throat will happen, and yeah, sore throat will happen. And rhinorrhea means running nose. Diarrhea means what? Loose stools, right? Same way, rhino means nose, rhea means leakage of fluids. Yeah. And confusion, because our whole organ is failed. Now, of course, we'll feel drowsy, and now electrolyte balance is disturbed. So it in turn causes confusion, dizziness, headache, rhinorrhea, chest pain. Of course, if we know that even in fever, like if so much phlegm is there in the lungs, or so much since consolidation is there, so we start to develop chest pain. And hemoptysis, sometimes what happen, I told, blood leakage will be there. So when the patient coughs, through his cough, he can cough blood also. That is hemoptysis. Diarrhea, I told GI symptoms will be rare, because AC2 receptors are is present in the GI tract also. And abdominal pain, 90% of patients present with more than one symptom. 15% of patients present with fever, cough, and dyspnea, and most children present with mild symptoms without fever or pneumonia. For children, there will be having only mild symptoms without fever or pneumonia. And if you see in the pregnant woman, retrospective review means we have we are studying about the cases. So while studying the cases of pregnant women with COVID-19, we have it is report same kind of non-pregnant adults, what are all the symptoms they are having, they're also experiencing similar symptoms. Coming to the diagnosis, pulse oximetry, arterial blood gas, full blood count, comprehensive metabolic panel, and serum troponin, and serum lactate dehydrogenase, serum creatinine kinase, blood and sputum culture, real-time reverse transcription polymerase chain reaction, chest X-ray, CT chest, ultrasound. I'd like to tell little about everything. And second. Yeah. So pulse oximetry. So people will, I told, right, oxygen saturation will be low. What happens? Have you seen in kidney patients and all? In kidney patients, this creatinine, Bu, and nitrogen level will increase in the blood because kidney is no longer able to excrete out the waste materials, and then this causes, and oxygen saturation in the blood is also low. This causes cyanosis. Cyanosis means development of blue color. Blue, because all these waste materials are getting accumulated in the body. So cyanosis started to develop. So in that case, because this pulse oximetry is used to check the saturation of oxygen. And arterial blood gas, that means hypercarbia or acidosis. But I told, right, increase in the carbon dioxide, decrease in the oxygen, because gaseous exchange is not happening properly, acidosis increases. So what happened? Arterial blood gas we have to see when a corona patient comes to us. Then full blood count means this neutrophils are getting destroyed, oxidative, and leukopenia will happen. Leukopenia means destruction of leukocyte means WBC. Lymphopenia, leukocyte, because all our, in one or the other way, all our body system is hanged, all our body system cannot work properly. So what happens? Leukopenia and leukocytosis and neutrophilia, thrombosis. I told you, right, fibrinogen will be released. Fibrinogen means precursor for fibrin. Clot formation will be there because leakage of plasma leakage of plasma fluid is there, and viruses, it will develop into a shock due to systemic circulation. Shock has to develop, means there has to be thrombus formation. So when thrombus formation is there, D-dimer, this means D-dimer means that is a degradation product of clot. Okay, D-dimer is a degradation product of clot. So these are all this will all help us to understand if there is any what I should say, clot formation. And the coagulation screen means checking of D-dimer and prothrombin time to see if there is any bleeding or clot. So inflammatory markers, procalcitonin. I have already told while taking that shock seminar, like procalcitonin is an indication of bacterial infection. So in this corona, it will be normal. But if procalcitonin is high, it shows that it is secondary, that some bacterial infection is secondary to this coronavirus. Then serum troponin will be released. Serum troponin means in cardiac injury, myocardial injury will happen, right? Because the heart workload to the heart is increased, heart rate increases, heart is unable to pump blood. This gives more stress to the heart. So in turn, troponin level will increase due to myocardial injury. And serum lactate dehydrogenase will increase. This is indication of liver injury or lysis of blood erythrocyte. This also may be elevated. Then serum creatinine kinase. Serum creatinine kinase, that also is an indication of muscle or myocardial injury. Kinase enzyme, right? Kinase means movement. So kinetics means movement. So kinase means helps in the movement. Which organ will help? Muscles will help in the movement. So creatinine kinase is in an indication of muscle injury or myocardial injury. Then blood and sputum cultures. We have to see. We can take a swab actually from nasopharyngeal or oropharyngeal area. We can take a swab and see for the sputum cultures, or develop this culture, means develop the microorganism. Then we can see which microorganism is the causative agent. And real-time reverse transcription polymerase chain reaction. This means that transcription polymerase chain reaction, this actually helps us to quantify the mRNA, this reverse transcription polymerase chain reaction. And chest X-ray, computed tomography, ultrasound. This is very helpful actually. I'll show you one scene. This is chest X-ray. Can you see this ground glass opacity? This can you see? Hello?
Yes.
Yeah. This ground glass opacity. Because of this ground glass opacity is due to this interstitial edema, which won't be very clearly visible in chest X-ray. If you take an X-ray, it won't be clearly seen. So we will prefer for CT scan. Here it will be seen very clearly, ground glass opacity, and consolidation with air bronchogram. I have already told with consolidation. So you can see the consolidation. Then crazy paving pattern that indicates that septum membrane is there, no, septum thickening, interstitial fluid thickening, and membrane thickening. So what happens? Superimposed intralobular septal thickening. Lobules means alveoli sacs are actually called lobules. So intralobular means inside the lobules. Septal means wall thickening will be there. Then ground glass opacity with superimposed inter, and inter also it had inter means in between two lobules. Intra means inside lobule. So septal thickening can be seen. And ultrasound. When you see this ultrasound, if you are very if you're very good at diagnosing, then you can go for ultrasound. Actually, you can see this air bronchograms, B line and all. This B line actually interstitial pulmonary edema. You can see the thickening of B line, right? You can see many B lines, right? It shows the interstitial edema, how much severe it is. Then consolidate. Then it also what I should say, pleural line thickening can be seen. Pleura means I showed you in the picture of lungs. Pleural thickening, the wall of the lungs is called pleura. So since edema happens, pleural thickening also can happen. And then lung consolidation happen. Lung consolidation means this we have seen in this only. What is this? Consolidation with hair bronchogram. So in that CT scan it was clearly visible. So using an ultrasound, it is if you are very very good in diagnosing, very skilled, then you can see if go for ultrasound. Better is always CT scan. Sir.
Okay, done?
No, sir. Actually, I should do management also tomorrow. I will do, sir.
Oh, okay. Tomorrow you will continue, huh?
Yes, sir.
Okay, okay then. I think it was a very nice presentation, given a very detailed explanation. So when you will continue?
Okay, sir. Tomorrow I will continue.
Tomorrow.
Yes, sir.